Alrighty, my audio is now on. I apologize, my friends, for being a little bit late today. We had some major technical issues, and I believe we have sorted them all out. So we appreciate your patience. When you stream live, sometimes it seems like a lot of times technical issues start to happen, and so I'm not sure exactly why, but we will get to the bottom of that, I think, sometime soon. So appreciate your patience. This is going to be a really great show. If you have anybody that you know in your life that is currently dealing with any kind of heart condition, cardiovascular disease, heart disease, anything like that, make sure to tag them if you're watching on Facebook or if you're watching on YouTube. Send them an email, because what we're going to do is take some listener questions after the break, and we can have this opportunity to ask Dr. Lundell some questions about heart disease and things like that. If you're new here, we broadcast 3 days a week on Monday, Wednesday, and Friday at 10:45 a.m. Pacific time. So if you guys want to join the live show, this is kind of a unique time to be able to ask some of these doctors and medical doctors and naturopathic doctors and alternative doctors and researchers questions, and I'm going to do my best to start making sure that we ask a lot of your questions. So if you're in the chat room and you have a question for Dr. Lundell today, type it in all caps. That way I can see it and I know immediately right away that it is a question for Dr. Lundell. So this is a good chance for you to ask your specific question. So this is episode 627, and if you want to grab the show notes, anything like that, just go to extremehealthradio.com/627. Let me bring up my show notes here for you, or actually our show schedule. Got a lot of cool stuff happening on Extreme Health Radio. Like I said, we broadcast 3 days a week. So on Monday, this is Friday, and then on Monday we're going to have Zirin. I don't even know what his last name is, but I just became friends with him sort of on the internet, and he's done a lot of work with Lyme disease, EMF, and things like that. So we'll be talking with him about Lyme disease. He's got a really great YouTube channel called Know How Things Work, I think, and produces super high quality stuff, and I think that's how I found him. And then on Wednesday, we got Dr. Nick Berry. We'll be talking with him about essential oils. The name of his company is Essential Oil Wizardry. So if you're interested in essential oils or know anybody that is, you may want to pass this show on to them on Wednesday. And then on Friday, we'll be talking with Krista Gerard about what I think is sort of at the heart of a lot of people's health conditions, and those are things that are not even physical. We'll be talking with her about family constellation therapy, and getting into this deeper esoteric, emotional, spiritual side of disease, and it's really fascinating. So with all of that said, make sure to subscribe to our channel if you haven't done so already. That way you don't miss out on any shows. If you're listening on iTunes or listening on Facebook or watching on Facebook, subscribe wherever you're consuming this content, and we will make sure to get notifications out to you so you can make sure that you stay up to date with all of our shows. All right, so today we got Dr. Dwight Lundell, like I said, episode 627, and he has a resume that just sort of goes on for days and days and days and days and days and days, and he's just a really great guy. And let me just read a couple of his things off of his bio so you can get kind of a framework for what he's done. He's done over 5,000 heart surgeries on people, and he went to the Yale University School of Medicine. He was a chief resident cardiothoracic surgery from 1978 to 1979. Yale School of Medicine, University of Arizona, Arizona Health Centers, chief resident general surgery. And he's been at this for 25 years, and he was actually the pioneer of something called the off-pump heart surgery, reducing surgical complications and recovery times. And he's in the Beating Heart Hall of Fame. That's cool. Never heard about that. Beating Heart Hall of Fame. And has been listed in Phoenix Magazine's top doctors for 10 years. So like I said, his resume goes on and on and on. But let me go ahead and turn up his audio and bring him on the show. And Doc, how are you doing, my friend?
Well, I've been doing better, but I have no complaints.
Yeah, we're talking a little bit about that before the show, but yeah. So whereabouts are you located?
I'm in Paradise Valley, Arizona, Phoenix area.
Oh, okay. Have you been there for a long time?
I have. I came back to Phoenix after training in 1979. I'm a native of Arizona, so we were delighted to be back here and enjoyed a wonderful, wonderful career of practicing cardiac surgery here.
Yeah. And you were over in Yale for quite a number of years as well?
I was there 2 years. I actually went to medical school in Arizona. I was honored to be in the very first class
Oh,
of a
wow.
brand new medical school. And then I finished general surgery training at the University of Arizona, and then spent my last 2 years of cardiovascular surgery training at Yale.
Oh, interesting. Wow. Yeah, yeah, yeah. So do you like Arizona and the weather? It's always sunny, isn't it?
But it's always sunny. Sometimes it's extra sunny. Today happens to be a gorgeous day, about 70 degrees with bright sunshine, cool air. So it's great to be in Arizona, although we have to get a little bit tough in August.
Yeah, yeah, that's true. That's true. I'm going to bring up your website for people because this is a relatively new website that I found. I was searching all around for your website and I couldn't find it. And I found a WordPress site for you, but you told me before the show. Let me bring that in here. Um, it says here, Confessions of a Maverick Heart Surgeon and Ironman. Wow, that's interesting. So you did the Ironman and different things like that?
I have. I've completed 10 full Ironman,
Wow.
which doesn't say I'm very smart, but it does say that I can endure a long athletic event. And we actually, I after I retired from doing surgery, I fell in with a bad crowd at the gym and started doing Ironmans. And I did my very first Ironman on my 65th birthday
Oh my
and
goodness.
won my age group and was honored to go to the World Championship at Kona. I finished as high as fourth in the World Championship. And in 2011, I was the International Triathlon Union World Champion. So we've had a lot of fun doing it. And for a non-athlete, it's been really an interesting experience.
Yeah, so what made you decide to get into that at the age of 65?
Well, as I say, I fell in with a bad crowd and they said it'll be fun.
Yeah. That's always the way it works, right? Someone else tells you it'll be
Right.
fun. Interesting. Yeah, so how long did you train for that particular Ironman, your first one?
Well, I think the first one to do takes probably a year of training to build up the mitochondria and the endurance muscles to be able to do the 2.12-mile bike and then a full marathon.
hmm Now, is it true? There are a lot of people that are out there these days doing ultra marathons and things like that, where they're running 100 miles. There's a guy by the name of Dean Karnazes that does all that, and he just runs for like he'll do a marathon a day for 50 days in all 50 states. Just crazy stuff like that. Do you think that's really impactful and negatively impactful on your cardiovascular system?
I don't. There's been a fair bit written about endurance events and atrial fibrillation,
hmm
um, but I don't think it's the endurance event. I think it's other factors that might give us atrial fibrillation. And then if you look at the entire population that has atrial fibrillation, 99% of them are couch potatoes and 1% are athletes. But yet, athletes think they're immune from anything by doing these events.
Right, right. Yeah, I think that's the problem, right? People are couch potatoes, like you said, and then they want to get out there and compete like they're professionals and quickly realize they're not. you know, Interesting. Yeah. So when was your last heart surgery? When did you retire from doing that?
I retired from heart surgery in 2004.
Oh, okay. Yeah. And how many? So it says on your bio, 5,000 heart surgeries you did. That is an incredible amount. And how long of a time did that span for you?
Well, that was over the 25 years of my practice, and that 5,000 is just coronary bypass surgery. We did several thousand valves and lung cancer and aneurysms and all those kind of things. So there's probably 7 or 8,000 total surgeries, 5,000 of which was coronary bypass, because my career spanned the heyday of coronary bypass surgery, and from early stages when we were just starting to do them in the mid 70s, and then I started in 1979.
Hmm.
And I was very busy. I've never been very good at many things, but I happen to be very competent in doing that, I'm happy to say. And it was really satisfying to take care of sick people and make them better.
Yeah, interesting. I'm looking at your website here. It says Confessions of a Heart Maverick, or a Maverick Heart Surgeon and Ironman. Get the true stories hospitals don't want public. Can you give people a little teaser if people sign up to your newsletter? What goes on in those stories that you're talking about there?
Well, yeah, I will. There's a lot of bad things. I mean, the third leading cause of death in the United States is medical errors or medical side effects. Think of that.
Mm.
And so medicine now, I was just discussing this morning with one of my longtime cardiology friends that, medicine is, nobody thinks anymore.
Hmm.
All we do is follow protocols. And the protocols are written by panels put together by the drug companies or panels put together by device makers who make the protocols. And now with the electronic medical record, your physician is monitored in everything he does. And if he doesn't follow those guidelines, then he or she is in significant trouble.
Mm. Yeah, they call that the standard of care, don't they?
Well, it's called the standard of care, correct. And if you don't follow it, you have committed malpractice. And so even though your cardiologist may not fully subscribe to prescribing statins, he's got to do it. He's forced to. And, there's so many medications that have side effects that are devastating. Uh, for example, my current facial paralysis is a side effect of a blood thinner I was on, which caused some bleeding into my eighth nerve and around the base of the brain and paralyzed my seventh nerve. So that was a side effect of one particular anticoagulant. And so here I am with facial paralysis. Now, I never was very pretty, but hopefully it'll recover. But once again, that's a side effect of a medication that I may or may not need it, and we may have selected a different type, but the physician who prescribed it was following a protocol, and I had no knowledge to object.
Hmm.
Over and above that, the medical literature today is just an advertising arm for big pharma.
Hmm.
Every article you see is written and edited, and probably 95% of all medical literature published today is in error for one reason or another.
Wow, 90. You think 95%?
Right, 90 to 95%. Now, it isn't all malfeasance and isn't all dishonesty. It can be small samples. It can be bad experimental design. It can be bias in the beginning of setting up the experiment. And we're seeing more and more actual malfeasance. There's currently a website called Retraction Watch, which monitors all the studies that are retracted. And usually it takes pretty blatant misconduct to get a study retracted, but it happens every single day now.
Wow, yeah. I'm just bringing this website. I'm going to just bring it on to the show. You might be able to see it, Doc. Is this the right website? Retractionwatch.com?
Correct.
Wow. And what does this website do?
Well, it publishes all the studies that are retracted by the journals or
Oh,
by, for example, the one at the top, the cancer researchers. I think the university retracted his.
interesting.
There was just recently a researcher publishing stem cells for heart failure, and he just fabricated the data. And I don't know if you remember the Vioxx anti-inflammatories. An
Uh-huh.
anesthesiologist actually was fined a huge fine because he just made up the data. He fabricated it out of thin air.
Isn't that crazy? Wow. So these
It's
people
crazy.
can, so what happens? People can make up things, and then what happens to their career if they get found out?
Well, hopefully that's the end of their career and it's the end of their chance to mislead all of us. It's when I was
Yeah.
a student and a resident, if it was in the medical journal or a textbook, it was like sacred writ.
Right.
And doctors all over the world depend on the medical literature to make clinical decisions that sometimes are life and death. And if we have protocols that are wrong, then we're going to hurt people. And that's one of the reasons we have so many medical errors and so many medication side effects, because we don't really try to cure anything anymore. We just try to treat the symptoms with drugs.
Mm-hmm. Yeah, there was I shared this story a couple times before on the show, but my wife we just had twin baby boys about 4 months ago, and she had a really challenging pregnancy. It was really, she had her body had a fibroid that was like a 9 centimeter fibroid. And so at one point her pregnancy got so bad that we actually went to the emergency room. And I was so, neither of us wanted to go because we're the most naturally kind of based people out there, but the pain was so bad that she couldn't even move. And so they really wanted to get her on a medication. I forget the name of the actual medication, but I think I put it on our Facebook account or our Instagram account. But they were really pushing hard for her to take this sort of anti-spasmodic, anti-seizure kind of medication because her uterus was contracting and it was pushing on the fibroid, and it was just all this pain. And we kept saying no, and then finally we finally said no, and then we went home and researched it, and we found out that particular medication can cause birth deformities, birth defects, and sometimes even death, or even death in the mother during the birthing process. And I just think to myself, like, it's so amazing that we have this ability, don't we, in 2018 to be able to research things online and go to a website like Retraction Watch or something. It's just, what would we do without that?
Yeah, it's an interesting dichotomy. For example, we take great care of trauma patients. We take great care of injuries and joints and lots of things we do really, really good. Mm-hmm. But treating chronic diseases is where we've fallen apart. If a patient with a chronic disease gets cured, then Big Pharma's lost a customer, and the doctor's lost a customer. So, we have the good and the bad.
Yeah.
And we have some in the middle, but for example, I was in the hospital for this brain bleed, and I could have died from it. And we debated surgery back and forth, and ultimately the risks were way higher than the benefits, and we didn't do it, and I'm glad we didn't. But nevertheless, it's funny in medicine because, once again, we do some things really, really good, and we do some things completely rotten and wrong.
So what was the beginning for you when you first got involved in going to medical school many years ago, and you started researching and learning and doing your studies and things and being involved in all of that? At what point in your career, or was it even during the schooling, did you start sort of wakening up to all of this sort of at least the option of natural and alternative therapies? When did that start happening for you?
Well, it didn't happen until relatively late in my career. Once again, I was very busy to get training.
Yeah.
The residency was, 90 hours a week. And then I came into practice, and you had to be available. You had to do things. And we worked very, very hard. And I was raising a family and trying to make a living. Yeah. And you really didn't think about it. I mean, to a man with a hammer, everything looks like a nail.
Yeah.
And, I had the skills to fix your heart. And that's all really I cared about, was making my hammer better. And that's where the beating heart surgery came in, was making things better. But it was a little later, and about the late 90s, I began to say, we've been treating people with drugs, and they were supposed to cure heart disease, and they haven't. Mm-hmm. More than half of my patients have normal cholesterol. That doesn't make sense. And so I began really to think about it, and I looked down at the coronary artery on the heart, and it would be red and swollen. And that's two of the cardinal signs of inflammation. And then some really smart people started writing about inflammation and how it is really the trigger for atherosclerosis, or heart disease. Mm-hmm. And so that's when I began to really think about doing something different, and began to say, yeah, I'm I'm winning battles every day, but I'm losing the war. And so that led me ultimately to change what I was doing in my career.
Yeah. So in what way did you change? What was the biggest change?
Well, what I did was I decided that if inflammation was the cause of heart disease, and everybody knew that, all the bright guys from across the country had worked out all the details of the process. And knowing that inflammation follows injury, big medicine didn't ask what's causing the injury. Big medicine asked, what drug can we develop that reduces inflammation, and therefore we reduce heart disease. So we went all through these machinations of trying to say that statin drugs were anti-inflammatory. And they convinced lots of people they were, and they convinced they should treat people without heart disease but elevated CRP levels with statins. And so millions and millions of people were put on that drug unnecessarily. To tell you how crazy it is, right now there is a clinical trial going on treating heart disease with a very powerful immunosuppressive drug that was originally used in transplantation.
Really?
It's crazy. It boggles the mind. Wow. Why don't we ask what really is injuring the artery that's triggering this process?
Right.
Well, I guess there's no money in that, and that's why nobody has paid attention to it, except a few of us around the country who are trying to make some noise.
Well, I guess it makes sense from a purely sort of capitalistic perspective, doesn't it? I mean, if you can develop a drug that actually lowers some arbitrary number that may or may not be arbitrary, but many times it could be, and if you can sort of artificially lower that number to some degree or raise it, I guess, and there's money in that drug, I mean, it makes sense, but gosh, I just wish things were different. I wish doctors would be different.
Well, love makes the world go round, but money greases the wheel. And so, Pfizer has got in their pockets $120 billion from Lipitor alone.
120 billion?
From Lipitor.
Just from Lipitor. And they probably have...
30,
oh, sorry about that. We probably have... how many different medications do they have, I wonder, besides Lipitor?
Well, there are about 5 of the statin drugs. Wow. And we have some new ones now called the PCSK9 inhibitors. And I have a cardiology friend who's a great guy and a smart guy, but completely believes the cholesterol stuff. And he has heart disease. And he has now got his LDL cholesterol with his PCSK9 drug down to 30.
What? To 30?
And he's my age. And the evidence is very clear that in older ages, people with high cholesterol live longer. And there's no evidence that lowering cholesterol in anybody over 65 does any good. In fact, the evidence that treating people with a statin drug in any age, of any sex, is of minimal to any benefit and has side effects. I mean, there's a thing called the number needed to treat. And that is, if I treat 100 patients and I cure 99, then the number needed to treat is 1. If I treat 100 patients and only 1 gets well, then the number needed to treat is 99. And in fact, statin drugs are for symptomatic people or people with known heart disease. It's about 98. People without heart disease, so-called primary prevention, the number needed to treat is about 1,000.
Isn't that crazy?
It's bizarre. I mean, why would an intelligent doctor prescribe a drug that only has a 1 in 99% chance of helping you? Why would you take it if you knew that? They don't tell you that.
Yeah, well, I guess... I'm sorry about that. Sorry about that. I guess they are... that's their standard of care. They sort of have to, don't they?
They do.
Yeah.
They do. They have to. So don't blame your doctor and don't fight with your doctor about it, because you might need him for an infection where the number needed to treat is 1 or 1.5.
Right. Yeah. Golly, because I guess, if they don't follow that standard of care, if a patient's coming in with a high cholesterol or something like that, and they want them to, and the standard of care is to give them a statin drug. So what's the case? What's the scenario in that case? If a doctor does that enough times, and let's say they prescribe a series of natural treatments instead of a statin drug, what happens? Is that all being tracked and tallied, and then is doctor ultimately responsible if something goes wrong?
Yes. If I come in with high cholesterol, which I have, as a matter of fact, I'm proud to say, they don't treat me with a statin or put in the record that I refused. If I subsequently had a heart attack, then they're guilty of malpractice. That's a pretty easy case.
That's a pretty easy case. So they have to put into the record that you refused.
Yes. And they can do that, and that's in my record.
Mm-hmm.
And so they're stuck. They're stuck.
That makes sense. What are some of the other dangers of statin drugs? I mean, it's such a huge business. Like you said, Pfizer is $120 billion just from Lipitor, which is one statin drug. What are some of the other dangers, do you think, of these drugs they're giving people?
Well, the biggest danger, of course, is muscle pain. And it can go from the extreme of rhabdomyolysis, which is the dissolving, the destruction of all your skeletal muscle, to just muscle aches and pains, mental impairment. People can't remember anything. They got intermittent global amnesia, all those sorts of things. And as many as 1 in 50 or 1 in 100 will get new onset diabetes mellitus. Mm-hmm. So if the water supply in your town was different than the town next door, and in your town, 1 in 100, say, got diabetes, and the next town, nobody got diabetes, it wouldn't take very long for us to be changing the water supply. And yet, we still give statins like crazy.
Yeah, it's amazing. There's a medical doctor who's a friend of our shows. He was a former, just like you, wasn't a heart doctor, he's an anesthesiologist, but he was explaining to me some of the nuances with these drugs, and he was saying that the interesting thing about them is that they can definitely lower a number, that's for sure. But what he was explaining to me was that the actual disease process is still, some sort of invisible process that's happening in the background. So you artificially lower the numbers, but the disease process continues to happen. And so the person who's taking it is falsely led into a sense of complacency because he thinks that now that his numbers are low, whatever disease process he has is now gone. But our doctor friend was explaining that that's just not the case.
Well, that's true, and that's why it's such a fraud. Mm-hmm. Doctors have been defrauded, and millions of patients have been defrauded, and they don't address the underlying cause. They don't address the root cause of coronary disease, which is why I changed my career to try to address the root cause and see if we can make a difference.
Mm-hmm. Now, when you did that, are you catching any flack from colleagues, or I see you still have the MD in your name? Are you catching any kind of flack from people for getting to the root cause?
Oh yes, I tried to get the hospital changed,
yeah,
and of course they didn't want to hear that because that's a huge revenue stream.
Yeah.
I mean, I probably made the hospitals $200-300 million over my career. But they didn't want to hear about doing anything different than upsetting that revenue stream. So as I say, I wanted to do something different. So I retired from surgery and I opened a clinic where we put people on a specific diet and specific supplements. And I proved that, number one, that risk factors for heart disease, maybe lipids and that sort of things, which really isn't a risk factor if you get down to it. But I also showed that you could reverse diabetes, type 2 diabetes. I took people off insulin, I took them off their blood pressure medicines, took them off their oral diabetic medications. So I proved that diabetes could be reversed, and I proved that the so-called risk factors could be reversed. And that was a huge thing to me to see that. And people were spending $1,500 to $2,000 on medications a month, and yet they became disease-free and they became drug-free.
Wow, that is just fascinating. Yeah, that's really, really fascinating.
Yes, I did. I did catch a lot of flack. I'm not as smart as some, and so I decided to try to expand the reach of this clinic and sought around for ways to do it, and uh, didn't really succeed very much. But we did have articles published on the internet. One article has been on Facebook probably 2 million times by now.
Wow.
I wrote a book called The Cure for Heart Disease. Now it's a little bit old now, but
Uh-huh.
most of it's still true. And I was making a lot of noise, and been on Fox News 4 times, on the internet, publishing articles here and there.
Mm-hmm.
And at any rate, so I'd completely retired from medicine. I closed the clinic, and the Arizona Medical Board told me they were going to review some cases. Some was old as 10 years old. And ultimately, they reviewed them and took away my medical license.
Oh, wow.
Now, in one way, I wasn't using it, so I didn't care.
Mm-hmm.
And in another way, it was so wrong and unfair and a blemish on an otherwise unblemished 25-year career in mainstream medicine that it did hurt me.
Mm-hmm.
So, you can either call it a blemish, or you can call it a badge of honor for trying to correct what's wrong with mainstream medicine. And I'll let you be the judge, but I've chosen to think of it as the latter, that that I took they tried to kill me, but they can't, and they can't shut me up. They have no control over me anymore. And I'm delighted to be on your program to try to tell people how to get rid of their heart disease or prevent it.
I love that, Doc. You're awesome. This is so great. We're with Dr. Dwight Lundell. We're going to take a short little break here. If you want to check out his website, it's drlundellmd.com. And I have to say, when I was searching for him, I typed in, because I'd known about Dr. Lundell for many, many years, and he's always been someone that's been on our radar to have on the show. And when I typed his name into Google, the first website that came up was Quackwatch. And I know that if he made it on the Quackwatch, then he's someone that we really need to have on our show. I consider that to be a badge of honor. So this is a really great show. A lot of people have been asking us, some of the different protocols that we do for improving our health and, maintaining good health. And, one of the big things that we've been doing lately is using this Magnetico sleep pad. Let me bring this up on the show here so you guys can take a look at it. It's essentially a magnetized mattress that you can put on your bed. And what's amazing about it is that you can benefit from this healing mattress for 8 hours while you sleep. And sleeping in a magnetic field is really, really interesting. It's a tremendous way to offset a lot of the wireless radiation, dirty electricity that is in our walls and in our environment, the ambient, dirty electricity and wireless radiation. And it uses over 2,000 different magnets in these pads. And these pads weigh I think 75 pounds each. They're it's really quite a system to put on your bed. And for those of you that are familiar with the Dr. Robert O. Becker, back in the 60s, he was an oral surgeon, and he was studying salamander, and he was looking to regrow the limbs using a positive, negative, electric, and magnetic field stimulation. And he was able to do that. Which is really fascinating, right? Using magnetism and electricity and using these things together. What's great about the Magnetico mattress pad too is it's one of those things. It's not like a Vitamix blender where over time it will break on you and you have to buy another one. You buy this thing once and it only loses about 6% of its magnetic output over 50 years. And the magnetic field of the Earth has significantly weakened over the last 4,000 years, over 80%, in fact. And so bringing more magnetism into your life, especially during the evening, that's when the magnetic flux of the Earth is highest. And so improving your body's exposure to magnetism during the time that you sleep is incredibly beneficial, incredibly healing. You can get them for your kids. You can get them for your own bed. You can get them for your pets even. We're going to do that here pretty soon. And it's interesting too, because back in the Babylonian Empire, they said that the magnetic field of the Earth was around 3 to 5 Gauss. And now it's less than half a Gauss at 0.5. And some people say that when the giants or dinosaurs were on the earth, it was around 300 Gauss. So this is really a unique sort of thing to put on your bed, and we're just big fans of it. Our kids sleep on it, and it's just really, really cool. And that's kind of why we put in our store 3 different areas for light, water, and magnetism, because really we are electrical beings long before we're physical. And it was Tesla that said, if you want to find the secrets of the universe, think in terms of energy, frequency, and vibration. And so they were nice enough to give you guys a 10% code. So if you guys want to upgrade your sleep, I highly recommend it. I highly, highly recommend it. It's going to be one of the best things. I always think that, the best places to optimize for your own health are areas of your life where you spend the most time. And sleep, obviously, is going to be a third of your life. So make sure to check out the magnetic code. The code is EHR10 to get 10% off your order. And then the other thing I wanted to share with you about was this really cool red light therapy device that we've been using. I've been using this every single day, especially during the summer months the winter months here when people usually get like this seasonal effectiveness disorder or something like that. Let me bring up a picture for those of you that are watching on live on the show. You can see me standing in front of mine right there. And it produces so much red light, and red light is the healing frequency of the sun. The problem with today's culture is that we get too much blue light, and blue in nature is always balanced by purple and red. And so what this thing does is it allows you to bring in the red healing frequency, which stimulates the DNA and the RNA in your body, which is incredible. It helps to increase your blood flow. It helps to carry waste. It improves and increases ATP production, and allows you to hold on to more light, and also increase electron chain transport in the mitochondrial membrane. So it's incredible. Makes and allows the mitochondria to work better, faster, to make more water, in fact. It's great for skin damage, collagen production, muscle recovery. So yesterday I used mine after my workout. I haven't done a workout in about a week, and so I use mine after a workout. It's also incredible for scars, wrinkles, stretch marks, but wound healing, anti-aging, stuff like that. But what I really look at it is mitochondrial food, because all food is tied to photosynthesis, and food is just a repository of light. And the more we can start working with light in our life and bringing in the good frequencies, the beneficial frequencies, the healthier we're going to be. And the number one way to stimulate the mitochondria, one of the number one ways is through light. Frequency, vibration, temperature are all other ways the mitochondria get stimulated. So wanted to tell you guys about the Juve red light therapy. And this thing is modular too. So what's cool is you can actually build your own sort of light system here. And if you're watching online, you can see the picture of this guy being sort of surrounded by 4 different panels of this Juve red light therapy. So I highly recommend this thing. And we use it ourselves, and I think you guys would really love it. And it's great to bring some of these healing tools into our lives, our homes, so that we can be healthier and improve our health, improve our mitochondria, basically, which is tremendous. Genetic expression and mitochondria all tied together. So it's important to make sure that your mitochondria are working and functioning properly, so we have a long, healthy, disease-free life. So let me bring Dr. Lundell back on the show, and I want to ask him. We've got a handful of questions. Got a few questions. I think what we'll do is we'll take some questions, Doc, from the chat room. But before that, if you guys are in the chat, maybe type your question in all caps, and that way I will know it's a question, and I'll ask him in just a second. But I wanted to ask you, going back, we kind of mentioned this a little bit, Doc, at the beginning of the show. I have a friend of mine who has atrial fibrillation, and it's one of those things where a lot of people are, prescribing different medications for it. And so what's going on, do you think, with atrial fibrillation? And is there an electrical component with the body? What's happening there? And what's the cure, or I guess answer for that, I should say, not cure?
Well, I'm not sure I have the answer for it, but if you do a biopsy of the atrium, the upper chamber of the heart, there will be a huge number of inflammatory white blood cells in the wall of the atrium. So in my mind, it's an inflammatory disease, much like coronary disease is an inflammatory disease. And so my recommendations is, we'll get into my recommendations for treating or preventing heart disease and treating heart disease for that matter in a bit, but they would be the same for atrial fibrillation. And in addition, I would recommend that people get a good dose of omega-3 from fish oil. It stabilizes the membranes and stops this erratic electrical current that's happening in the atrium. Now, medications to control the heart rate are effective. Sometimes ablation of a certain spot in the atrium that's triggering this is successful. Sometimes it's not successful. It's a little controversial right now. But many people go many, many years and are relatively asymptomatic with atrial fibrillation. So it's not a death sentence, and it's not, the end of the world. People can function relatively normally with atrial fibrillation, although it's better not to have it.
Yeah, exactly. We've got a question here from a regular listener. I got a lot of really cool people in the chat room, and it's really great. I love seeing you guys as regulars. Let me see here. Let me bring in a question. Chris Zellers wants to know, hey, Justin, can you ask Dr. Lundell about D-ribose? I think you had Dr. Sinatra talk about this. And we did. We had Dr. Steven Sinatra on a few years ago, and he spoke about this. Do you know anything about D-ribose, Doc, and its role in the heart?
Actually, I don't know enough to make a comment. So
Okay.
Sorry.
Yeah, no worries. We all have, limitations on our knowledge. Okay, Kristen says, oh, is the Magnetico okay in an apartment in a city? Okay, I'll get to that, Kristen, maybe at the end of the show. But Oscar says here, Oscar Torres, great to have you here. He says, is cholesterol used in the body to repair veins and artery cracks? Good question.
Well, it's used to repair a lot of things, usually at the cellular level.
Mm-hmm.
And it really doesn't repair the big wounds in the blood vessels, like a plaque or a fractured plaque.
Okay.
But it is used all over the body in every cell to repair lots of things.
Mm-hmm. Mm-hmm. Interesting. Yeah. We had a doctor on recently, Dr. Jennifer Daniels, and she also is a medical doctor. And there's also Dr. Hal Huggins, who I remember before he passed away, he would always say the cholesterol numbers that he was showing in over 300 different data points was 225. And then we had Dr. Daniels, who's a medical doctor, on the show, and she likes to see people in the high 200s, low 300s. I tell you, if you tell your doctor that you have that high of a cholesterol, they'll put you right on Lipitor, won't they?
Absolutely. Yeah, my total cholesterol is 300 and something. My LDL is almost 200. And the cardiologist I'm going to now for these blood clot problems was just freaking out.
Wow.
He had a panic attack when he saw those numbers. But he also did a cardiac cath on me 2 years ago, and my coronary arteries are completely normal.
Interesting.
In spite of my whole life of having a total cholesterol of over 200. So there you go. That's an anecdote, but it's important to me.
Yeah, I mean, you're right. It's anecdotal, but for you, it's experiential. So it means the most to you. And Dr. Daniels was saying, over 300 for a total cholesterol, and she was saying the same thing you were just saying, Doc. Is like, she sees that there's a longer life associated with higher cholesterols, and I think she was saying also that when you bring your total cholesterol down to, I think 180 or something like that. I think it's like 170 or 160. You can't even produce hormones correctly. Is that right?
Yes, they're used to produce all sorts of hormones. And so the idea that we should reduce cholesterol and the idea that we have good and bad. So Justin, maybe we should write a book, the morality of molecules or something like that.
Yeah.
I mean, how's a molecule good and how's a molecule bad? I mean, the whole thing has been twisted in such a lie to promote this idea of treating a number. And it is treating a number. It's not treating the disease. Mm-hmm. It's doing nothing to the disease. And the idea of so-called atherogenic dyslipidemia that's not even an accurate term. There's no such thing, although it's used all the time.
Mm-hmm. Yeah, I've heard it said before that just because cholesterol is found at the scene of the crime doesn't mean it actually committed the crime. And, it's kind of similar to how our bones are full of calcium, but, calcium is a sort of an end chain biological transmutation process when different minerals combine with each other, like selenium and magnesium and things. And your body creates calcium out of those things. And just because there's calcium in a bone doesn't necessarily mean that you need to eat lots of calcium. And same thing with cholesterol. It seems like there's some other process there and some reason for that being there. And like you said, it's probably most to do with healing inflammation and inflammatory processes. It's healing and building hormones and things like that, right?
Yes. So it's basically cholesterol is an energy carrier to deliver triglycerides to the cells. And, VLDL is made in the liver if you eat lots of carbohydrates. They're packaged as triglycerides, which is fat. And the VLDL then carries that fat to the cell. When the fat is gone, it becomes LDL. And so it's completely irrelevant to heart disease. The key is what is injuring the blood vessels. That's the way we change this process, not by treating some number.
Right. It's how the blood vessels are operating and what's going on, how elastic they are, and what the state of the actual blood vessels are. Right.
Right.
Yeah.
Absolutely. And so I'll just jump in, and heart disease death rate has fallen, but the number of people with heart disease continues to rise. 650,000 people died last year. And yet we were promised in 1980 that heart disease would be eliminated with the statin therapy. So it's just completely wrong. So the thing that's changed in our society is the amount, not the amount of fat we eat. We've lowered our saturated fat. That's done nothing. And by the way, there is no metabolic pathway for saturated fat to become cholesterol. That whole story is so dishonest and so brainless that anybody that says saturated fat causes heart disease, just should be ignored. They don't know anything about metabolism.
So
the real cause.
Sorry, go ahead, Doc.
The real cause of heart disease today, now that not so many people smoke cigarettes, is hyperglycemia or elevated blood sugar.
Okay. So we've heard it said on our show that a lot of times these elevated blood sugar is causing inflammatory processes, and these processes affect the inside of the arteries, and then there are microscopic tears, and then your body creates cholesterol to patch that up. Is that model kind of what you're talking or hinting about here?
Well, it's not quite that way. What happens is the endothelium, the single cell layer that lines all 60,000 miles of our blood vessel, is exposed to the bloodstream. And while some cells have insulin receptors and can say no to insulin, the endothelium can't say no. And so the amount of sugar in the bloodstream is the same amount that's in the endothelial cell. And you were talking about mitochondria. Now, we make our energy in mitochondria either from glucose or from fatty acids. And it's a nice little well-controlled furnace, making heat, making energy. And if we throw gas on that fire, then bad things happen. Oxidative stress, free radicals, the mitochondria get destroyed, the cell gets destroyed, the endothelial cell gets destroyed. And that's what causes then the inflammation that triggers white blood cells to consume oxidized or glycated LDL. Normal LDL goes in and out without disturbing anything. Only if there's an active inflammatory process, mostly triggered by hyperglycemia, will the white cells then consume the abnormal LDL. And that's how it gets deposited in the wall of the blood vessel. It didn't go there to repair anything. It went there just going in and out. And the activated macrophage saw that it was abnormal. And the macrophage's job is to kill whatever it sees that's abnormal. And so it eats this oxidized LDL and brings it inside. And then it turns into a foam cell, which then turns into a fatty streak, which then turns into a plaque, which then ruptures and gives us a fatal heart attack. So it's all about what is injuring the wall of the endothelium. Now, it could be inflammation from somewhere else in the body, like rheumatoid arthritis or dental caries or something like that. But if you look at the United States, with over 100 million people diagnosed already with either type 2 diabetes or pre-diabetes, you know that that's only half of what's really out there. And so we all have hyperglycemia. It takes only 1 teaspoon of sugar to raise your blood sugar from 0 to 100. And if you drink a Coca-Cola or a glass of healthy orange juice, you've taken 9 teaspoons of sugar. So that's sort of the magnitude of the problem. We would never let our child eat 9 teaspoons of sugar out of the sugar bowl, but we'd happily give them a glass of juice or a soda.
Isn't that crazy?
Once again, that is not fatal, but over time, repeated injury, and we build up the fatty streak and we build up the plaque.
That's so fascinating, Doc, because that's a really great explanation. I'm going to have to go back after this is published and listen to that explanation again. But it is fascinating because all you hear about in the news is low fat. You go to the grocery store, everything's low fat. Saturated fat is going to kill you. But there's no sort of biological mechanism, is there, for us to turn a saturated fat into our body, or a saturated fat that we consume into fat in our body or high cholesterol or anything like that, right? It's not accurate.
No, there is no pathway from saturated fat to cholesterol, period. End of story. The fat that we eat can be stored as fat in our body, that's for sure. But that's stored fat. That's not circulating LDL. And once again, circulating LDL, if it's not oxidized or glycated, meaning it has a sugar molecule attached to it, it's normal. It goes about its business and does its work. And it boggles the mind that the Heart Association just this last year issued a presidential advisory against saturated fats. Now, the whole thing is stupid because if you sit down and eat a steak, about 7% is fat and 2% is saturated fat. If you pour olive oil on your salad, 7% is saturated fat. And yet, olive oil is a sacred fluid of the Mediterranean diet. And so somehow people have just turned their brain off when we talk about cholesterol and fats and what really goes on. Now, the epidemic of heart disease didn't start because we ate saturated fat. We eat less. The epidemic of heart disease started basically for 2 reasons. We started smoking like crazy, and our sugar consumption went from, less than a few pounds a year now to about 180 pounds a year. So I would take an old nutrient, fat, and blame it when we have a new nutrient that we're taking in huge quantities.
Yeah, it's man, I've looked at the stats recently a while back of the amount of pounds of sugar people are eating a year. It's mind blowing. We have another question here. Says Kristen wants to know. Oh wait, let's see. Donna wants to know. Going back to the atrial fibrillation, does a doctor recommend blood thinners with atrial fibrillation?
Yes, they usually do. For this reason, the atrium usually contracts, and when atrial fibrillation is just sitting there kind of quivering, and clots can form in the atrial appendage, for example, which is a little tag off the end of it. So that's the reason people are put on anticoagulation, so that clot won't break free from the atrium and cause a stroke.
Now, do you think there are things that people could do in place of blood thinners, like cayenne pepper or nattokinase, things like this, that might be solutions? Obviously, we can't play doctor here, but if someone wanted to research things like that, would that be a good option, do you think?
Sure, they can research that. That would be fine. I think, once again, these are protocol driven, and it's possible that an aspirin would be enough. It's possible that the stroke rate isn't hugely different between not anticoagulated and anticoagulated.
Uh-huh.
Now, a stroke is devastating and nobody wants to see one. So research it, take a look at the numbers, anticoagulated versus non-anticoagulated, take a look at the numbers of natural therapies and see if they add up.
Mm-hmm. Good stuff. Let's see. Kristen wants to know, and this is a substance I'm not very familiar with, but she says here on YouTube, thoughts on cholestyramine. It sounds like maybe some kind of drug. It's a drug, but used as a binder like charcoal and clay. Do you know anything about this drug or this medication?
Sure, cholestyramine is called.
Okay.
It's a very old drug. It was one of the first therapies. And what it does is bind the cholesterol in the intestine and so that it can't be reabsorbed. It was one of the very first drugs around to treat cholesterol. But it really doesn't do anything.
It really doesn't do anything. Okay.
No.
Is it still prescribed to people even though it doesn't do anything because they can make money off of it?
It might be. It's a very old drug, so I'm sure the patents are expired, and I've never seen it prescribed, to be honest with you.
Yeah.
And I wouldn't take it. It doesn't do anything.
Interesting. Yeah. Oscar wants to know, is it true that taking cayenne pepper can get you out from a heart attack? Do you know anything about that, Doc?
I don't. I've never heard that. And if you have a heart attack, there are some things that can be done. Once again, we do some things good and some things bad. Stents are overused like crazy, but in the setting of an acute heart attack, they can save your heart muscle and do a great amount of good. That's the one place that stents are very dramatic, is in the setting of an acute heart attack. They go in, dissolve the clot, open the lesion, and restore normal blood flow. So if I was having a heart attack, I wouldn't take pepper. I'd get my behind to the hospital.
Yeah. We've got a lot of questions here from people that are in the chat as well as sent them in via email. What are your thoughts? I'll try to distill some of these questions down because they're a little bit long. What are your thoughts about high blood pressure and how that relates to the heart and the cardiovascular system?
Well, high blood pressure is really high, injures the blood vessels, no questions about it.
Okay.
Just recently, we had, once again, these panels who lowered from 140 over 90 to 130 over 80, the quote unquote normal blood pressure. So this opens up a huge number of people for treatment that previously were not treated. Now, if one looks at the numbers of people treated and the number of time, especially the older folks who stand up after sitting in a chair and then fall over and break their hip because they're taking too much blood pressure medicine, it's dangerous. And I think the new rules are very similar to the statin rules. They just created another 100 million people with hypertension who really didn't need to be treated in the first place.
Mm-hmm. Yeah, I can see that. Let's see, another question here, kind of jumping around just a bit. Do you have any thoughts about how to clean your arteries? This was a good question that came in, I thought. Do you have any thoughts about that? Is that possible?
I do. It's a dynamic process. Wounds heal, and a plaque is a wound in an artery. And if you stop or reduce the inflammatory stimulus, then it's going to heal. I've seen plaques regress. They don't go away. There's still something there in your artery, but it's not going to rupture and kill you. So the answer is make sure you have normal blood pressure. Make sure you don't have a chronic inflammatory process somewhere else in your body that's stimulating injury to the blood vessels in your heart or neck or head. And so arteries can heal. Plaques can be reduced and regress. And if you want to call that cleaning your artery, that's okay.
Mm-hmm.
But that's the only thing proven so far. Calcium scores, the calcium scoring, they can even be reduced if you, once again, reduce the stimulus for injury to the artery. And William Davis, the wheat belly guy, did a study which I reviewed pre-publication, and he was the first one to report reduction in calcium scores with the use of omega-3 and vitamin D.
Oh, interesting. Omega-3 and vitamin D, and that was helping to reduce the calcium. Interesting. Yeah. All right. We got another question here about hypertrophic cardiomyopathy in a young guy about 17 and was recently diagnosed. Are there any solutions for hypertrophic cardiomyopathy? I know I was diagnosed with this when I was about 15. I had to stop playing high school basketball as a result of it, because back then, I think that was in the early 90s or so, a lot of the sports players were dying, and like Hank Gathers, and there's Reggie Lewis, I think. There was another guy, a bunch of basketball players, football players. And what I've subsequently learned was that some people have been sharing with me that the medication they were on, combined with the high output and not changing their exercise routines, basically contributed to their death. And I don't know if that's true or not, but with regards to hypertrophic cardiomyopathy, Doc, what are your thoughts on some solutions for that, or if there is any?
I don't know. I would be talking out of my field of expertise. Once again, you try to look for the root cause. And if it's, for example, obstruction of the outflow tract or a narrowed aortic valve, that might be it. If it's just simply too much exercise, the solution is obviously to change the kind of exercise you do. And those are the solutions.
Yeah, it sounds to me like a lot of your work is sort of debunking the conventional myths out there, and with regards to saturated fat, with regards to cholesterol, but then really pointing a lot of this stuff to our diet, and namely sugar intake. That seems like it's a huge culprit in all of this, right?
Absolutely. That's in my book. That's the key. Go buy yourself a glucometer at the drugstore. That's $15 or something. And if you have dinner and your blood glucose is over 140, don't have that dinner again. You can check your own blood glucose every day and modify your diet, cut down your sugar, or up your exercise so that you don't get hyperglycemic after you eat. Now, if you've just done a workout that is more than a couple hours long, and you've reduced your glycogen levels, then you can eat some sugar without your blood sugar going up, because it's got somewhere to go.
I see.
Now, it's got to go somewhere. It either goes into the cells and makes glycogen, but when the liver and muscle are full of glycogen, they say no. And in that case, it's got to be converted to triglycerides and stored as fat. So, and once again, if you're over 120 to 140, you're hurting your arteries and you're stimulating the process of atherosclerosis. So if you're worried about heart disease, get a glucometer and make sure your fasting blood sugar is less than 100 or less than 90, and make sure your post-meal is always less than 140.
And how long post-meal would that take, do you think?
2 hours.
About 2 hours. Yeah, we've heard people talk about 85 in the morning. Is that, fasted blood sugar of 85? Do you think that's too low, or is that a good number?
Oh, no, that would be better.
That'd be better. Okay. Interesting. So when you're working out, because sometimes this is what I'll do is I'll do a workout, and then afterwards I'll allow myself a piece of fruit or something like that. And so after a hard workout, then that's when you can have a little bit of sugar, because there's somewhere for all of that to go.
Correct. Yep. Once your glycogen stores are full, then it's going to produce high blood sugar, which then produces a reduction of fat, and then it's stored as fat, and we get fat and we stay fat. I've gone as long as 5 hours on a bicycle training ride with no sugar, and yet I see all of my triathlete friends, stopping every 30 minutes and putting another gel or another Gatorade in, which is completely unnecessary. We can go a long time. Some of those distance runners now are going on fat only and very, very little sugar. The guy who won the Western States 100 last year is really famous for eating almost no sugar or starch on his runs and using mostly fat. Now, he's trained himself and got his physiology fat adapted, but it can be done for exercise that's not up past, say, 80% of peak.
I see. And what's this guy's name?
I think it's Zach Bitter.
Zach Bitter, interesting. Yeah, we'll have to look into him. I know that that guy I mentioned before, the ultra marathon man, Dean Karnazes, is listened to some stuff with him recently, and he was talking about this exact thing. Is when he first started doing ultra marathons, he was doing the conventional gel packs like you were just talking about, but now he's switching more to a ketogenic kind of a diet, doing lots of fats and retraining his body, and he seems to be responding pretty well to that.
Cool. I did not know that. I've known about Dean and amazed at his feats, but it's pretty cool. Now, the most famous one is Professor Tim Noakes in South Africa, who wrote The Law of Running, and yet he found himself with type 2 diabetes and said, if you have the law of running, tear out the nutrition chapter. And so now he's famous for promoting a ketogenic diet, and just went through in South Africa, where he's from, a 4-year trial to take away his license because he tweeted to a mother, wean your child to low carb, high fat diet.
Wow, that's crazy.
He spent 4 years and millions of rand to defend himself. Ultimately, he won, and the Dietitians Council didn't win. So he's the most famous case. And I don't put myself in that category, but there's a surgeon from Tasmania who was prohibited from giving dietary advice, a low carb. He was sick of amputating diabetes patients' limbs and told them to eat low carb, and he was disciplined for it. And only recently, after several year battle, did they officially withdraw the restriction and apologize to him.
My goodness.
And it's happened around this country as well, in more than one case, both dietitians and physicians being disciplined or punished for recommending a low carb, high fat, moderate protein diet.
Yeah. Do you yourself follow a more ketogenic approach with high fat in your diet?
I'm trying. The answer is yes. I've never been totally ketogenic for a long time. I'm in ketosis after a long exercise session. And I don't, the ketogenic diet sometimes is overdone. We're all ketogenic early in the morning if we didn't have a midnight snack. If we went to bed at 9 o'clock after a supper at 7, every one of us makes ketones every day, all the time. So we don't have to be spilling them in the urine or the breath to be getting the benefits of a low carb diet plan. Now, I would like to lose a few more pounds. It'll make it easier for my next Ironman.
Yeah.
And so I'm working pretty hard right now on trying to get more consistently into ketosis, because that way I'll burn my own fat and get myself adapted. So that's my goal. I'm working hard at it.
That's awesome. When's the next Ironman?
Don't know right now. I really want to go back to the World Championship in October, so I have to do another Ironman to qualify for that. And we're looking at July, maybe Lake Placid, maybe Canada, which are lake qualifiers. So I've got to recover from this little episode and get back to training hard.
Nice. A couple closing questions in closing here. Let's see. Oscar wanted to know, do you know anything, Doc, about hyperbaric oxygen? We did a show with a medical doctor a little while ago about hyperbaric oxygen therapy. Do you know if that can help the body assist to heal any of those internal wounds with regards to heart disease? Do you know about that?
Well, I think so. It's an interesting field, and is used. Lots of hospitals now have chambers for wound healing, and so if it'll heal an external wound, I'm sure it can help heal internal wounds as well, in places that are deficient or in places that need extra oxygen to assist in the healing or the metabolism process. So I think it's a worthwhile thing to investigate if you're having troubles.
And finally, Doc, a question from the chat room. This will be the last one that we take today. This is from Kristen, and she wants to know. This is interesting. This is more kind of like a philosophical question for yourself. What's the best method to introduce someone who is in the sort of pharmacy medical system? What's the best way to introduce them, do you think, to holistic medicine and natural medicine? Do you think?
That's a tough one.
Right.
That's a tough one. There has to be some, well, first of all, individual experiences, testimonies are very powerful. And if I tell you and I have just lost 20 pounds by cutting way back on the carbohydrates, and that should be a powerful instigator for someone to begin to believe that it is possible. So we have to show examples, and then once again, if it's an argument, we never get anywhere. I mean, you argue religion or politics, half the country hates the other half because they voted for somebody or didn't vote for somebody. So that's hard to convince, but you have to try to show gently evidence, anecdotes that are powerful, and personal experiences to a friend. I don't think anything can be more powerful than that. It's going to take a while. The current treat symptom with medication paradigm is so powerful and so driven by huge industries, hospitals and pharmacy, that have such power over the regulations that it's going to take some time. Now, people are beginning to get the Department of Agriculture to open up about the dietary guidelines and showing them that for the last 50 years, they've had no evidence to support them, and to try to get them to change from the high carb, low fat advice that has been such a disaster to less carbs, more healthy animal fats. And so people are working hard to try to change that. It's going to take time. There's a huge paleo movement. There's a huge ketogenic movement. There's a huge low carb movement around the country, and it'll happen.
Yeah, it just takes time, right? I should have mentioned this before we started the show, but you did bring up your book, and for those that are in the chat room or watching on the replays, audio or video, take a look of Dr. Lundell's book, The Cure for Heart Disease: Truth Will Save a Nation. And it says here, The Cure for Heart Disease, although written in everyday language, is different than any other book exploring the number one killer of Americans. A riveting yet straightforward discussion that challenges public consensus, explains the reasons for epidemic of heart disease, and provides an easy-to-follow guide to eliminate heart disease and reduce the risk of heart attack and other debilitating diseases. And the name of the book is The Cure for Heart Disease: Truth Will Save a Nation. So I just wanted to briefly mention that. And Doc, thank you so much. I apologize for all the technical issues we had before we went on the air, but I'm glad we got those worked out, and thanks for being on today.
Oh, you're very welcome. It's been a pleasure, and thank you everyone who's watching and will watch.
Awesome. And where should we send people? To drlundell.com, and then they can sign up to your newsletter? Would that be the best thing for people to do?
Yes, drlundellmd.com.
md.com. Well, Doc, I appreciate your work. Keep doing good work, and a speedy recovery for you. And I'm looking forward to hearing more about your triathlons and adventures and things.
Oh, thank you.
Awesome. All right, Doc. Thanks. Have a great day. Okay.
We'll do it.
Okay. Thanks, Doc. Bye-bye. All right. Well, there you go, my friends. Dr. Dwight Lundell. What did you think about him? Interesting guy, right? See what you guys are chit-chatting about in the chat room here. Be Light says, are there any natural ways to tend to assist in the pituitary gland? You know what? He wouldn't be actually. Let me take these off so I can actually. I don't know what it is about those things. I don't like those very much. But yeah, that would have been a question for more of a brain surgeon. So maybe like Dr. Cruz would have been a good person to ask that question. Chris says, Barbara O'Neill, Misty Mountain, retreat on cayenne pepper. Interesting. Okay, yeah. There's a lot of people talking about the benefits of cayenne pepper, and I was just listening to Dr. Jennifer Daniels the other day talk about, I guess there's some, no, it wasn't Dr. Jennifer Daniels, it was Dr. Sherry Rogers. I don't know if you guys are familiar with her, but she has a lot of great books on Amazon, and she was talking about, I can't remember. I'm exposed to so much information, but she was talking about some substances that you can take after a heart attack or during a heart attack that sort of mitigates the effect of the heart attack and how much it damages the heart by up to 50%. And I think that's detailed in her book, Is Your Cardiologist Killing You? And so there's another book of a guy talking about cayenne pepper and taking that if you feel like you're having a heart attack. So there's a lot of different things that you could do with regards to preventing. Yeah, I mean, imagine Oscar saying here DMSO. DMSO, imagine combining DMSO with magnesium right on the heart, or DMSO with cayenne pepper. I mean, geez, talk about powerful. There's another doctor that was on our show that was telling me a while back that one of his nieces was coming down with a flu one night, and what he did with DMSO was he opened up a capsule of olive leaf extract, because olive leaf is really tremendous. It has something called aleuropin in it, and it's tremendous for building the immune system. And that's why we have the one that we recommend from East Park Research in our store. But it's tremendous for building the immune system. And so he opened up a capsule on his niece and combined it with DMSO. And then the kid's cold just broke like within 10 minutes. Fevers and chills and hot and cold and sweating and all that. And he was actually worried that he might lose his license as a result of putting olive leaf extract, rubbing that on the skin from a capsule, and then combining that with DMSO right over the chest. But there's all kinds of things that we can do, like Oscar, you're saying DMSO. And what's really great and empowering is that, there are options to healing out there. I just made a natural remedy with cayenne, turmeric, pineapple, hot paprika, and manuka honey for a natural painkiller and good for flu, blood, and heart. Yeah. Gosh, turmeric, great for the heart. Cayenne, yeah, those are all great. Hot paprika. Peppers are tremendous for the heart, always tremendous. You can always do that. And so that's the thing, is like we just need to explore and expose ourselves to information. Dr. Lundell, it sounded to me like he was, what did you guys think of him, first of all? Did you guys like him in the show? It sounded like to me he was more sort of critical of the medical industry and not necessarily up 100% on holistic and natural methods, but he was a medical doctor, and everyone sort of on our show brings a different perspective, and not a lot of people, or not everyone, is completely studying natural methods, and so that's what's challenging with a lot of this is people are different fields, people have different expertise and different experiences and different study, different knowledge, and so but it sounds to me like he is just really against this whole medicalized way of looking at the heart. And it's true, I mean, I know people who are I know someone who has, I think, 8 or 9 stents in his heart and is on cholesterol lowering medication. And, this kind of stuff is just, until there's other options, you're just going to do whatever they tell you to do, and without doing any research. And so I recommend to you guys that all of you research. So if you're ever in front of a doctor, just be kind and gentle to the doctor. Like he was saying, doctors, they don't know what they don't know. And, I feel bad for them because they've never been exposed to this kind of information. They just never have. And so it does no good, and it's of no use to argue with your doctor. Maybe if you want to plant some seeds in a nice, loving way, that's always good. But it's not our job to control people. It's not our job to get people to see the world the way we want them to see it, as if the way we see the world is the best, right? So if you're ever in front of a doctor and they're pushing medications, just, if you take the medication, just take it home and do some research. And that's what I was sharing during the show with the the medication that Kate was on. It was the not spasmodic, I think it was anti-contraction kind of medication that she was. But man, we took that stuff home, and we took that medication home, and it was like, dude, death in the mom and death of the children were some of the side effects, and mental retardation and physical deformities as a result of taking this medication. And these nurses were trying like crazy to get Kate to say yes to it. And then I was reading in different forums. I could probably bring it up on our Instagram. It's quite some time ago when Kate was probably about 6 months pregnant, so quite a while ago. But, I was reading in forums of these moms that were saying like, I wish I had known. I wish I had known that these things did this, because now I've got, a stillbirth, or now my kid is deformed in some way as a result of taking the medication. And you look at the side effects, and it's all right there. And these nurses were just literally pushing and pushing and pushing and pushing. And finally, Kate said, "No, no. I think we're gonna, we'll talk about it later. We'll do it later." And we just took it home and did research. And it's like what Dr. Lundell was saying, the standard of care. A lot of these nurses and a lot of these doctors, God bless them, they think they're doing good, but they just don't know any better. And they've been indoctrinated to think that their way of looking at the world and their way of healing the body is the only way. And they just don't know, like they don't know what they don't know. And so it's incredibly important, I think, for people to do research and to learn about options that are out there. Because you could start doing a lot of research and find out that, there's some incredible substances out there that can really help you, and if you don't know about these things, then it's not possible to even come to an understanding that, that they could help you. And so, like recently, I'll bring up this molecular hydrogen that we sell in our store. This is something that I've run across in the last couple of years, and this is by a company called Vital Reaction. And it says here that it has therapeutic potential in every organ of the body in over 170 different disease models. So I'm not saying that it can cure disease, but it's a pure mitochondrial food, and it helps the body in tremendous ways, and that's why we have it in our store. And let me bring up an article here. This one here is from Honey Colony. I think we had the owner of this website on the show. But it says here, molecular hydrogen is a tasteless, odorless, flammable gas that research links to helping battle aging, more than 5,000 diseases, including cancer, primarily reducing oxidative stress. So that's what it goes after in the body, oxidative stress. And I'm just going to say here that it doesn't cure cancer. So I don't want to get in trouble with the FDA or anything like that. But here's a guy who is going to be on our show soon, Tyler Lebaron. He says here, hydrogen is a unique and superior molecule because it can also activate the NRF2, the life-sustaining pathway, and increase the endogenous levels of glutathione and other antioxidants if they are lower than they should be. Molecular hydrogen improves cellular communication and provides cell-modulating property to the body to help prevent the formation of free radicals, says Ed Wonder, researcher of the Molecular Hydrogen Foundation. And it says here that he compares the work of molecular hydrogen to a cleanup operation in the factory belching out black smoke. Quote, molecular hydrogen will not only clear up the black smoke by neutralizing the free radicals, but it will also go into the factory and fix what is wrong so that the black smoke will not proceed. A 2015 study says here that H2, which is molecular hydrogen, may significantly help us keep better hydrated. A 2012 study concluded that drinking molecular hydrogen water was an effective fluid hydration strategy for athletes. This is significant considering studies show 2 out of every 3 people are partially dehydrated. And so this is an incredible substance that we have access to. And there's all kinds of studies. You can learn all about the benefits of molecular hydrogen and its effects on the mitochondria. And this company, Vital Reaction, makes these tablets that you can actually put in your water. And it helps to dissolve this molecular hydrogen anti-inflammatory gas into your water. And we did a whole show with Dr. Mark Circus about it. And you can learn more about it if you guys like. But it's stuff like this that if you don't know about it, then you'll never understand and never come to the conclusion that these types of alternative therapies are out there. And the other thing that I want to tell you guys too is this: the Relax Far Infrared Sauna. This is a healing tool that we have in our home, and we just sent a few out a couple days ago. We just got an email from a lady in Singapore, and we can ship all over the world with these Relax Far Infrared Saunas. But these are sort of healing devices that I like to bring into my home and turn your home into sort of a wellness sort of facility where you have like the Juve and you have these different. I have the IMRS mat and the Relax Far Infrared Sauna, and it's really great for cardiovascular health. That's one of the things, and one of the reasons why I use it is it's tremendous for cardiovascular health, as well as detoxing chemicals and poisons from your fat cells. The far infrared rays, what they do is they go deep inside your body, much deeper than near infrared rays, and what they do is they oscillate the fat cells, and the fat cells are where a lot of our chemicals and poisons get stored. So the more fat you have on your body, the more chemicals that are sort of dissolved or sort of hiding out in that fat. And the far infrared light helps to go in and mitigate that and oscillate those cells to squeeze out those chemicals and poisons. And then they come out through your skin, which is the largest organ and detoxification organ of your body. And so this is why I love the Relax Far Infrared Sauna. I sit in it every single day. Took a couple months off during the summer months when our kids were born, and I really missed it. I get to watch DVDs in there. I watch Netflix movies. I watch documentaries, and it's just a really great thing. And a lot of times what I'll do is I'll do like the rapid release to stimulate my lymph system. I'll do a rebounder, and then I'll do the far infrared sauna, and then after that I'll do the Juve light, which is more light. And so the far infrared rays is actually a light technology, and so just a big fan of bringing more light into our lives, more detoxification, more ways to cleanse and heal the body. And so, yeah, if you have any questions about the Relax Far Infrared Sauna, let me know. Send me an email, and I'd be happy to answer. Someone was saying too, let's check out the chat room. I love you guys here. It's so much fun. Urine Animals here. Awesome. Great to have you here. Rebecca says we need more docs like him. That's true. It's too bad he's retired. There's a doctor who, there's an interesting story of my wife and co-host. As soon as we can get her back on the show, we're going to do that because I love having her on, and she's fun. And her story of the C-section, which she had. And I can tell you guys a little bit about that if you guys like. But Noam says, hey, Justin, can you get Mike Moo on the show? He speaks about how correct oral posture and posture affects jaw growth and so on. He's currently under attack by the British Orthodontic Society. Yeah, Noam, can you send me a link? Is there any way for you to send me a link to him? Mike, M-E-W. More than happy to take a look at his work, and for sure. Yeah, I just like people. There's so many people out there doing great work in the world, and we could interview 20, 30 people a day and still not get to 1% of the amount of amazing people out there that are helping make this world a better place. So happy to do that. Oscar says here, talking about heart, I've seen a young man suffer an angina because of stress. It was 2009 when the economy went down. He was the owner of a small construction company, and I guess he's went bankrupt. Yeah, with regards to the heart, it's interesting because recall healing, I think, really plays it gives an interesting perspective on the heart and heart disease and heart attacks specifically. And if you look into the work of Gilbert Renaud is his name, but Gilbert Renaud, I think as you say it in French. But he has a really interesting work he's done on spiritual aspects and how they play a role in heart attacks. It's really fascinating. Joe Mama, I have one of these. I flippin' love sweating out the toxins. Oh, cool. Great for those suffering with Lyme like me. Oh, cool. So do you have the Relax, Joe? Yeah. It's really important with, in these days to really detox. We have to detox. Detox is more important than the food we eat. We're exposed to so many chemicals. Did you guys ever listen to the show we did with, or watch the one that we did with Stephanie Seneff? She was talking about how how she's presuming that there could be glyphosate in the air that we breathe, because 10% of gasoline is made from ethanol, and ethanol is highly sprayed with glyphosate and Roundup. And so, it's crazy. So with the amount of toxins coming in, I mean, detoxification has to be a part of all of our lives. It just has to. It stinks that it's that way because, just by the default living, you can see I'm wearing a full shirt right now because I have a blue light on me. And there's been studies showing the blue light on skin and its relation to skin cancer, not the sun. And so that's why I'm covering up. I'm covering up my eyes with these blue blocks glasses. And, just being in today's world, just living a normal average life, you're exposed to so much, And so that's why reducing the amount of toxins that are coming into your life and then detoxing what you do have in your body out is super important. Super, super important. If you want to live a long time, we were never meant and engineered to live the way we're living. It's just not normal. And so, unfortunately, we have to do detox protocols, on a daily basis. Hey, Joe, I wanted to let you know we have a guy named Zirin on the show on Monday. That's going to be a live show. Hey, Eric, good to have you here, my friend. Yeah, awesome, cool. We have a guy by the name of Zirin on the show on Monday, and he's done a lot of work with Lyme disease because he has it. And he's a local guy here, but he just moved to Colorado, and that's a place where we're considering talking about it. Should we move to Colorado? Should we stay here in Southern California? But we'll talk with Zirin on Monday at 10:45 about Lyme disease and see what he's doing for Lyme. He's got a great YouTube channel called Know How Things Work. So type that into YouTube, Know How Things Work, and you can find out a lot of his cool videos. Maria, good to have you here. This is cool. Just listening and reading the comments. Awesome. Joe says about the sauna, the Relax Far Infrared sauna. Yeah, this exact one. They fold up to practically nothing, so easy to store. Yeah, we keep ours out, but that's what's great is that you can lend these to a friend, these saunas, and or you can put it in a room. You don't have to break down a wall or anything. It's not these huge things you have to set up. What I like about the sauna too is that it preheats, so you just turn it on and you're sweating in a matter of minutes. I've sweated in as little as 5 minutes before. In the winter, it might take me about 15, 20 minutes to start sweating if I get in there really cold. But man, you walk out and you're just dripping with sweat. And I just think to myself, there's so many toxins in that sweat, and I just feel so good doing it. Oh, cool. Joe, you're local to Southern California? That's awesome. Yeah. Still Earth Journey. Why do you think there is so much deception? What do you mean deception with regards to natural health? That's an interesting and deep question. I'm curious still Earth Journey, what your thoughts are or what your response to that is. Do you mean deception with regards to health? Well, there's a big deception with regards to health for sure. All you have to do is read a book called Murder by Injection by Eustace Mullins, and you can learn about what that deception is with regards to the natural health community, because natural health is a direct threat. All of this stuff is designed just to make money, all of it. And so when natural health impacts your bottom line, it's just about money and control, and that's really what it's all about. And so in order for them to lie to you and to continue to make money off you, they need to lie to you, and they need to keep you in fear so that they can control you and make money off you. And that's just the way our society works. I used to be upset about that, but it's a good world we live in. It's an amazing world. Rebecca says, so glad for you. I think I'll make the investment. Oh, to the sauna? Yeah, I've been researching them. Yeah. We just love ours, man. We just absolutely love it. Maria says she's just got a tornado warning. Interesting. Whereabouts are you located? Tornadoes. Wow. Gosh. Eric says, I just started wearing long sleeve indoors as well. I had no idea how bad blue light is to your health. I have a pair of blue light glasses on the way as well. Yeah, Eric, this light thing is much bigger. It was sort of like a, scratching or provoking the giant when I started learning about light for me. When I started learning about it, it started opening up so many more doors with regards to the mitochondrial impact light has. And that's why I did that spot today for the Juve, as bringing in the Juve light. Because, man, this light thing is a huge deal, and no one's talking about it. It's the elephant in the room. Dr. Doug Wallace says 85% of all diseases are the result of mitochondrial depletion and the mitochondria not working properly. I mean, think about this. You have 3,000 to 10,000 mitochondria per cell, and you have over 100 trillion cells. So the amount of mitochondria that's actually controlling genetic expression is just so massive. And when we focus on the nuclear genome, which is what people are eating and what people are consuming, it's really the wrong place to look. Because if it really were true that, you know, diet and food was everything, then why is the diet industry still a multi-billion-dollar industry? You know, how come people still need to lose weight? It's really a light issue, and it's all about light, water, and magnetism. When you start learning that, you start realizing that, you know, food, like I was saying before, food is tied to photosynthesis, all of it. It's tied, the food web is directly tied to sunlight. And that's the work of Adam Bergstrom. You look at his work, yes, no, maybe, chronobiotic nutrition, that's eating food at the right time. That's because food is a repository for sunlight and biophotons, and those over 1,500 different frequencies and 10 to the 46 power different wavelengths of the sun that our mitochondria directly interact with. They interface with the sunlight. And when we're putting on light on our bodies from indoors, it's really important to protect yourself. Like it's probably worse, in my opinion, than eating fast food. Exposing yourself to all of this blue light. And that's why, like, we have the Iris software in our store for turning off all the blue light on your computer. My computer just got fried the other day, and I just got it back today. So this is why the thumbnail for today's show is still old. But, you know, it's the first thing I'm going to do is turn on Iris and get that blue light off the computer screen, and wear these orange glasses, and wear, you know, clothes indoors protecting our skin from blue light. Because there's, you know, if you look at your phone, for example, when you first wake up, I think you were looking at 6,500 Kelvin, and that's with blue light with no red or purple as a mitigation strategy for that. The sun is perfectly balanced. The sun upon rising is about 1,800 Kelvin. And so when you look at your screen, your cell phone or your laptop or your iPad, before you get sunlight in your eyes, you're telling your body it's solar noon, 12 o'clock in the middle of summer, you know, on the equator. That's what you're telling your body. And so all of those hormones that get released when you look at the sun or look towards the sun in the morning don't have a chance to fire off and don't have a chance to connect to your pituitary gland. And so we're doing so much damage by exposing our bodies to this fake light. So yeah, Eric, I'm with you. I'm definitely with you. You know, I'm starting to wear more clothes inside. When I'm indoors, the glasses go on, the clothes go on. When I'm outdoors, the glasses come off and the clothes come off. So that's kind of the way it goes. Completely opposite of our modern culture, right? Eric says, is the far infrared sauna good for candida? Geez, probably. I don't know. I don't know if it is or not. I know that it will help build the immune system. There's a lot of work. I think on our sauna page we have videos from Dr. Rhonda Patrick talking about how it increases heat shock proteins and increases the immune system by 40%. So if the immune system is working properly, I would imagine that it would be sort of cascading down to candida as well. So that's something to consider. Candida is typically the result of eating too much sugar, as you already know. And so lowering sugar is going to be huge. That's going to be the number one thing. Starving candida of its food. You're an Animal says, I'll work on getting back to the live shows. Earlier, battling EMF and sleep, I experienced a new EMF noise 2 days ago. Freaked me out. Mega time. Hey, You're an Animal, did you get a chance to hang out with Brian Hoyer? He just did a home assessment for our house a couple days ago, which I should do a whole show on that. In fact, we are going to do I think you're down in San Diego, but we're going to do a whole YouTube video series about that. We filmed a ton of videos with Brian Hoyer, and our house is EMF toxic. So I'm glad we have the things like the Blue Shield and the Magnetico, things like that in our store to mitigate some of that. But man, oh man, oh man. So we are going to be looking at moving or doing a lot of the protocols that Brian sort of laid out for us. So I'll be sharing more about that. But EMF, in my opinion, guys, is on the top of the list of things to be concerned about and to learn about and to fix in your life. EMF is huge, huge, huge. The studies that are showing now its connection to allowing or breaking down the calcium voltage ion channels of your cells and allowing calcium to get inside your cells. Dr. Martin Pall did a whole bunch of work on this, and he was talking about how there's over 150 diseases that are now correlated with too much calcium being inside the cell, and EMF does exactly that. And so it's so important this is a huge environmental change. And I was telling Kate the other day, I think this environmental change right now that we have going on with 5G is the most significant environmental change that we've had since 1879 in the invention of electricity and bringing the light bulb and electrifying America. I think this is the most significant environmental change and shift that's happening is this 5G and electricity. And we're going to start doing some more shows on it, but man, it is super important to start learning about this stuff, because if you are living in an EMF toxic waste dump of a house, and your house is just completely EMF toxic, it doesn't matter. A lot of the other things, we're putting such a burden on our immune system that eating, taking DMSO, magnesium, and lowering sugar, sometimes you can do everything right. But if your living environment is toxic, then it doesn't matter what you're doing on a dietary basis. So getting to the bottom of this EMF thing, I think, is going to be huge moving into the future. And that's why Brian Hoyer, I think he's a building biologist. He's been on the show a while back, and I think that his work is going to be massive moving into the future. So true. So important, I meant to say. Still Earth Journey, I have been into the natural health field my entire life. Yes, it's a good place in our minds. We are our reality. Yes. Abrielle says, yes, do you have red light bulbs? We do. Yeah, we have red light bulbs. In fact, I'm going to be buying more. And check this out. This was an interesting sort of find by Brian Hoyer. So I've been led to believe that LED has a flicker rate. And for those that have never looked into the flicker rates are a big deal, because it's causing, it's the flicker. It's sort of like, remember you guys used to see like video of like old video when someone would be filming someone else watching a TV, and you'd see those lines going up the TV, or you'd see the flicker of a TV. Well, you can see it on a camera or another video, but you can't see it in real life because it happens so fast. And what the flicker rate does in lights are it damages our nervous system, and it damages our eyes. And so what it does is it causes the mitochondria to not be able to operate properly. And as you guys know, watching this show, is that the mitochondria is the name of the game, is the mitochondria. And so this flicker rate damages our nervous system and our vision and our eyes and our mitochondria. And so what I've always led to believe is that LEDs have a very high flicker rate. So before I knew this, we had bought and purchased some Sunlight brand red bulbs on Amazon that were LED. And so in my mind, I thought to myself, okay, having now learned about that, now we need to get new incandescent red bulbs. And Brian tested the flicker rate of these LEDs, of these lights, standard light bulb, just a red LED light bulb from Amazon called Sunlight. And it had zero flicker rate on his instruments, which is really interesting. I just thought that was really fascinating. So because of that, we're going to buy some more red lights. Incandescent red is the best way to go. I just saw a post on, if you guys like these glasses right here, these are from Blue Blocks, from Andy Mant, and they're available in our store. And he just put out a post on Facebook the other day, and he's considering creating light bulbs for people. I really like the work that he's doing over there in Australia. And so if he ever comes out with a light bulb, I will be buying his for sure. So You're an Animal says, no, I haven't talked to Brian yet. Too bad, because he was just in San Diego, actually. I think you were down there. Too bad. Bummer. Yeah, new Holocaust incoming. I know. I agree. I totally agree, man. This lighting situation that we're in, and EMF and 5G is in my opinion, one of the first places to start on a physical level. Ultimately, on a spiritual level, it's meditation, connection, personal development, things like that. That has to happen no matter what you're doing on the physical level. Working on the spiritual, emotional level, that's number one, in my opinion. But man, getting down into the physical, I think it's light, it's frequency, it's EMF and 5G. This kind of stuff is super important to mitigate, man. I'm telling you guys. No one's really talking about it, and I think we're going to do some more shows on it. It's kind of a bummer because it's not it's not really where I like to focus. It's not my passion to talk about, electricity and stuff like that. It's not really something, but I just think the information needs to get out there so much, and people need to understand how electricity impacts our health. And, if you look at the disease rates, I was looking at some charts a while back and looking at the disease rates and the amount of diseases that are sort of snowballing as a result of electricity, in my opinion. You look at those and you correlate them to 1879 when electricity was brought into the public, and you see just every disease just starts going up and up and up. And I was just learning recently that, someone was talking about EMF. Who was it I was listening to? I listened to a lot of podcasts about health, and someone was talking about EMF. Oh, Dr. Sam Milhelm, and we're going to get him on the show. But he was saying that in sub-Saharan Africa, there's no cases where they have no electricity. There's no cases of leukemia or cancer or any of these diseases that we have because they don't have electricity. And so this thing is big, man. It's really big. Like, we should not be living in electrified houses. The amount of dirty electricity, like, you guys will be shocked when we release those videos with Brian Hoyer. I found out that where I work in my home, in the room, is directly impacted. I'm standing in a field because I have a standing desk at home. It's standing in a field of radiation from my next door neighbor's deck phone. So my next door neighbor has a deck phone, and that's where they run their business out of. And they're on the phone all day long. And he picked up that deck phone from his instruments that I'm standing in that field. I mean, it's crazy, crazy, crazy. Let's see. You're an animal. You build your own LED lights? Wow. How do you do that? With zero flicker. Interesting. Cheap LED lights use a PWM controller pulsed with modulation. Okay. Which pulses current. It's power saving but toxic. Okay, so you're saying that you can create a LED light without the PWM pulse with modulation. Interesting. Yeah, Maria, LED typically, from my understanding now, is not good. Not just because of the flicker rate, which according to everyone else is super high. So you have the flicker rate with LEDs, unless they're mitigated, like You're an Animal is talking about. And companies do that. It's possible. But you have the flicker rate, and then you have the amount of EMF radiation coming off of it. And then on top of that, typically LEDs, if they're just standard LEDs, they're going to be power saving because of this thing that You're an Animal is talking about. But they also cut out all red and all purple light. So you're getting a 100% blue light with no mitigation, with no red. See, light was never meant to be stripped. Think of light like it's just a spectrum, right? So the sun has all the spectrums and colors in it, perfectly balanced. But when we bring fake light or LED lights into our bodies, they're leaving out all of the healing colors and all of the healing frequencies, which are the far infrared, and all of that, and all the red light and all of that. It's removing all the good stuff and leaving you just the bad stuff. That's why LEDs and any sort of compact fluorescent, like those big long tubes in office buildings, like that's 100% blue light, and that's damaging your mitochondria. So if you work in an area, if you work indoors, you have to make sure that you're getting outside as much as you can on a 15-minute break. You're protecting your skin. You're wearing yellow glasses so that you don't get too tired working in the daytime. because your body will start producing melatonin if it's if you block all the blue light. So that's why it's really important to make sure that you're aware of your light environment. And I've been working on this for years now. I just found out that a bill is being proposed for 5G to come to my state. That prohibits anyone from being able to refuse it. I may have to move. Yeah, you know what, Abriel, we're in the same boat. Right next to us in our neighborhood is, fortunately we didn't buy, so we're just renting right now. But our neighborhood is right next to a school and a church. And what's happening is that these companies, these wireless companies, are sort of hijacking places where there's lots of land, where there's no homes near it. So the current rule here in California is that you have to be at least 300 feet from a known house, and they call this the kill zone in this world. It's crazy. But technically they're violating that because the closest house to our neighborhood, to this tower that they have at a church, which saddens me. Oh my God, which is so crazy. They're paying the church to be able to take this 5G tower, and it's really bad. It's really bad. So what I'm understanding too is that all of our homes have dirty electricity in the walls. So the wiring, we're using alternating current, which is AC, which is not good, which is really bad for your nervous system. For some reason, that's what we went with when the power grid was set up. And so what we should be using is DC, direct current. But with this AC, you have a corresponding magnetic field. Anytime there's an electrical current running, you have a corresponding magnetic current running on top of that. And both of those are damaging to us. And that's what they call dirty electricity. And so if you have Brian Hoyer come out to your house, he'll show you, he'll put this meter up to a wall and it just screams. It's so crazy. And so what I'm understanding from Sam Milhelm now is that these 5G towers are going to be sort of put up everywhere. And the reason for that is because they're relatively not very powerful. And that's why they have to have a lot of 5G towers, because they have to communicate with one another. And since they're not that powerful, there has to be a lot of them. And so they're clear cropping trees now, which is the double impact, because now you don't have a beneficial tree for the environment, and then you replace it with something toxic. So you have that issue. But these 5G towers are actually jumping on to the dirty electricity that's living in your walls and exponentially making that even more dangerous. And so I think that's Dr. Sam Milhelm was mentioning that in a recent interview I was listening to him on. And so, this is just really bad, guys. And so, but you know what? I was talking to Brian, and this is what he said. He's currently working on his home. And you can actually pay him to come out to your house. And what he'll do is he'll typically try to book a bunch of people. Like he was just in Southern California, and he was here for like 8 days, and he had just people all day long, houses he would do checkups on and assessments for. And so what he was saying is that he could actually create his house, which is what he's working on, with the ability to use electricity, but make it a complete Faraday cage. So everything is completely mitigated. So any electronic device that you're using is not off-putting anything into the atmosphere, and it's blocked from 5G. So he thinks that it's possible to completely mitigate all electricity and wireless radiation of 5G. And, but if you want to do that, man, it's a lot of money. It's a lot of money. So before you buy a house, we have a whole video that he did with in our bedroom with geopathic stress. It was fascinating learning about this and how geopathic stress. So before you buy a house, have a guy like Brian Hoyer come to your house. And we didn't even, so it's one thing. So like you get this whole building or house wired correctly, right? Let's say you can get it 100%. You get all the EMF off of it. It's a Faraday cage. Everything's grounded. Everything's wired. Everything's connected. There's no electricity. So it's a completely zero environment in terms of radiation, right? So let's say you do that. But then you have chemicals in your house. And if you have a conventional house, you're going to have chemicals in your carpets, fire retardants in your beds. And so, man, I always thought it would be a cool business to start. And this would be really cool if someone did this. to start a truly biological home where it's completely a Faraday cage, mitigated all EMF, zero chemicals and zero toxins, but also the feng shui of the house is properly aligned. And the angles, there's no right angles, right? Because whenever there's a right angle, it's sort of counterintuitive or counter to nature, because in nature, everything's curved. There's no 90-degree angles and smooth and surfaces. In nature, everything is part of itself. Everything blends together, and that's the idea of creating more of removing these right angles from your home. And so imagine creating a home like that and having it look like a modern home, Spanish style, something really cool style. Like imagine having all of that into a home like that. Talk about a place where you can then really heal in your environment. Like that would be really cool. There needs to be people. My wife and I watch that show every now and then called Fixer Upper, with Chip and Joanna Gaines. I don't know if you guys ever watch that, but it's a fun, entertaining show, and we watch it for a couple minutes after we put the kids down. We have like 20 minutes before we're just exhausted after the kids go down, and we'll watch that show. But I often think, man, the amount of chemicals these people are exposed to and the extent to which they don't understand electricity and the wiring in the walls and when they rebuild these homes is just unbelievable to me, So I think it's really important to, focus on your home. That's what I was saying earlier in the commercial for the Magnetized Mattress and the sauna. Focus on bringing some of these healing tools into your home. Really work on that, because I think that's going to be, you want your home to be a place of healing, a calm environment where your body can regenerate, and so there's lots of different ways that we can bring, nature into our home, One of the things that I'm working on too is possibly buying a tent and sleeping outside, because this stuff, it means that much to me. Because you're looking at disease rates just exploding, autism is exploding onto the scene. We're going to have J.B. Hanley on the show here pretty soon, and he wrote a whole book about autism, but he's got a graph on the back of his book, and you just see it spiking, like diseases are going more and more, and the reason is because we're bringing more toxic elements into our life, and we're disconnecting ourselves from nature. So what better way? Like the cure is nature, right? Nature provides the cure to all of our health conditions. So how do we reconnect with that? And how do we do that in the most way possible? So, man, sleeping outside, get a tent, put it in the backyard. Man, now you've spending 8 hours a day outside. I mean, who spends 8 hours a day anymore outside? So I was telling Brian this, the building biologist who came to our home, and Brian Hoyer, he's been on the YouTube channel. You can check out our interview with him. But he was saying to step it up even more, and you can get you can do like a Faraday cage tent. How rad would that be? So I thought, okay, what if we did a Faraday cage tent, and then we had a grounded bed sheet with a stake outside? Now you're grounding yourself to the earth while you're in a Faraday cage while being outside. So it really makes a big deal. This stuff is, like I said before, I think that 5G and all of this stuff is the biggest environmental change since 1879. Bioengineering, Nikki says, as a weapon is also a grave concern. That's true. Yeah, weather modification, most definitely. Joe Mama says, why do red LED bulbs have no flicker since they're LED? Are red LED or red incandescent better? Thank you. Yeah, so I don't know why. Red incandescent would be better, in my opinion. I may stand corrected by, verified light experts and all this stuff, but incandescent, in general, any light that puts off heat is good. Because that's what light does. It puts off heat. So if a light doesn't put off heat, you know that some spectrum of the color frequency, the color temperature is being depleted. That's why LEDs typically don't put off any heat, because you're removing all of the red and all the purple, and those are the colors that put off heat. So I think the next bulbs that we buy are going to be either these same brands of the red LEDs, the Sunlighten brand, or they were going to be red incandescents. You're an Animal says, yeah, a pure DC circuit. You can buy individual LED modules of warm color ranges if you look. From a manufacturing standpoint, LED emits a lot of light from a small area, and they often need cooling head heat sinks, which can increase the size and cost. And also, customers don't like big things. Yeah, it's true. Yeah. See, it's just the same old thing with all this stuff, you know? It's like we think that we can lower the amount of electricity that's used by creating an LED that doesn't have the purple or the red, and that is energy efficient, but at what cost, right? All these things come at a cost. Still Earth Journey says, I feel for the children of tomorrow. Thank you for sharing this knowledge of 5G, etc. Yeah, you're welcome. I do too, man. Our kids are 4 months old, you know, and what kind of world are they going to live in, you know? The fortunate thing is that with every problem, there's a solution. So the unfortunate thing is that it takes a lot and more nowadays to come to those solutions. So that's the issue. Either more money or more time to learn about these things or something. So it's really a challenge. But that's the world we live in. You know, there are solutions to everything that is out there, you know. And so Still Earth Journey, I feel like it's my sort of mission to bring to light some of these things that people aren't talking about, like EMF and like blue light and things, because, you know, a lot of people in the natural health field are focused just on food. And food is, you know, across the mitochondrial membrane, and mitochondria controls genetic expression. So if you have a cancer gene, you don't need to worry about the gene. You need to worry about the expression of that gene, which is controlled by the mitochondria. And across the mitochondrial membrane, you have electron chain transport happening. You don't have carbohydrate transport chain. You don't have fat, lipid transport chain. You don't have, protein transport chain. You have electron. So all the food that we eat gets distilled down essentially into electrons. And so that's how, and that opens up the door to physics, which you start realizing, you know, our bodies are run on physics and spiritual principles and light and photons and things like that. And you start really wondering how we got into this mess, and we're still focusing on food, and food definitely helps, you know. Food is, you definitely want to make sure that you're eating the right foods, but man, to focus only on the food and avoid the mitochondria and the physics and light and frequency and sound and vibration and temperature is, I think, to your own detriment. You're an Animal says, I'm a camper of sorts now, Justin. I can't be in homes or buildings anymore. Wow. Yeah, you know, it's getting for me to be the same way, where I can't spend time indoors. The more I'm indoors, the more antsy I get. And I'm getting a little bit antsy right now. It's been 2 hours, and I need to get outside and get some sun. Right after the shows, I always go out. We're in an office building here where our studios are, and I go directly into the sun and take off these orange glasses and get direct sunlight, and I take off the jacket, get as much sun on my body as possible. So I hope you guys had a good time. Hopefully you got some good insights from Dr. Lundell. The post show is always where I love to hang out with you guys and have a good time. It's really fun talking with you guys, and it's more of a conversation, you know. You got some great people in here. Maria Abrielle is here. Nikki, Joe Mama, You're an Animal. Eric is always here. It's awesome to have you here, Eric. Rebecca. Let's see who else. There's just a lot of cool people. Oscar, Gnome, Be Light, another Rebecca. It's just really cool. Kristen Taylor, Christina Fitzgerald. So I just love hanging out with you guys, and it's a lot of fun. So stay tuned to our show. If you guys are new and haven't checked out our show, make sure to subscribe to our YouTube channel. The bottom right of this video is an area for you to subscribe, and share it with your friends too. I'd appreciate that. If you know of anyone that has heart issues, maybe they would like to listen to this show with Dr. Dwight Lundell. Let me just bring up really quickly our upcoming show schedule. I wanted to let you guys know too, all of our shows are brought to you by the Extreme Health Academy. Have you guys signed up to this yet? If you haven't, please consider it. Let me give you a free coupon. We'll give you a free 2-week trial. If you go to extremehealthacademy.com, there's a free 14-day trial if you use the code EHR14. So we did a whole show, or whole course about heart health optimization with Dr. John Bergman. This month we're releasing one in a couple days called, it's about the adrenal glands. And next month is, there's so much good stuff happening. Autoimmune disease courses, the hormone optimization course. Who doesn't have an issue with their hormones these days? Building invincible immunity course, prevent and heal cancer naturally. These are like super high level courses. The complete guide to digestion, your nervous system, and the 3 stressors, which is, the cause of all disease essentially is stress. Light is a stress. EMF is a stress. So how do we mitigate this kind of stress, and what do we do to fix that? That's what the 3 stressors course is all about. And so these are like high level courses that are being released every single month. And I want to let you guys know about it. If you're interested in the heart health optimization course, if you sign up to extremehealthacademy.com and enter the code EHR14, you'll get a free 14-day trial, and you can check out some of these courses and what they're all about. And we do other things too. We do weekly Q&A calls where we answer all of your health questions. There's a thriving, incredible community in there. People answering each other's questions just like there is here in the chat room. So a lot of cool stuff happening inside Extreme Health Radio, or extremehealthacademy.com. But it's only available for you guys that are really serious about your health. If you really want to take your health to new levels, you got to join this. This is really a cool place. And I don't get a chance to answer all of the emails that come in to me, but in the forums, I make sure to get back to just about everybody. So especially if I get, if you tag me, I'll respond. And so this is a good place for me to sort of get introduced to you guys and to learn more about you and to help you as much as we possibly can. So I wanted to let you guys know about that. Our upcoming shows, let's see, Zirin is here on Monday, and that will be about Lyme disease. We're going to be learning about essential oils and all of that with Dr. Nick Berry. And we rescheduled the show we had a lot of emails come in about Allison Huish, I think is her name, Huish, and how she overcame her brain tumor naturally using frankincense oil, essential oil. And so these essential oils are really powerful. So that's going to be on Wednesday. We can't say that essential oils cure cancer because they don't. Only chemotherapy can cure cancer, right? Only tongue in cheek here. So anyway, that's going to be on Wednesday. And then after the show next Friday is going to be really interesting. I'm looking forward to that one as well. Krista Gerard, we'll be talking with her about family constellation therapy. And, we are intricately connected to our family and our tribe. And it's really important to be connected with them and realize that we're not here alone, that we are connected to our family members 3 generations up at least and 3 generations below us. So that brings up a lot of questions. Are we living in a non-linear universe where all things are happening at the same time? So it's an interesting concept, this family constellation, and how systemic healing can happen on a deep level when we work with our family. It's really fascinating. So that's going to be next Friday. So if you're listening on iTunes, if you're listening on Facebook, make sure to subscribe to our channel and share it with your friends too. I'd really appreciate that. That'd be really cool. Yeah, thank you. Eric, it's awesome to have you here too, man. It's cool. I love your comments and the stuff you've been sharing. It's really cool. And how do you say your name? You say here Gualetio Shire. What a name. Gualetio Shire. Says, I love what you do. Well, thank you. I appreciate that. We do our best to bring out all the information that we possibly can, I just want people to know that there are options to heal. That's my biggest mission is, you don't have to go down the medical path if you don't want to. If you want to, that's great. Kate's sister the other day was saying how she doesn't think that natural cures work, and she's a big fan of the medical industry. And so that's fine. That's what she gets to do, and whatever ramifications happen as a result, that's the journey and the path that she chose. But what I want is, what sort of drives me a bit crazy and that I don't like is that when people, like it says in the Bible, that book, I forget what book in the Bible, but it says, my people perish for a lack of knowledge, and so my whole mission with all of this is like, everyone gets to choose what they want to do. If they want to do conventional, surgeries, chemotherapy, drugs, medications, flu shots, all that stuff, that's totally up to them. And they get to do that. I'm fine with that. I'm not here to change anyone's, sole purpose. That's their decision. They get to do that. But my mission is just to let everyone know that if you want something different, there are choices, and not just choices, but viable choices, choices that actually work, and in my opinion, work better than the conventional. But that's not for me to say. Everyone gets to choose, and so, that's my mission, is to let people know that there are choices out there, and I just want people to know, Nikki says each to their own is the only way home. It's true. You're an Animal says, my people perish for being unclean noobs. That's funny. That's true. So I just want people to know that there's choices, and what you do with that choice is, ultimately up to you. All of our decisions are ours, and there's nothing wrong with, people think, so-and-so was part of a natural health community and into natural health. How come she died or whatever, and, a lot of people were saying that about Jessica Ainsko, the wellness warrior, when she died, when she left her body, and, a lot of people say, if natural cures work, she wouldn't have died, and all of this stuff. But when you start taking a spiritual approach to all this stuff, it really starts making way more sense. Maybe she had a soul contract to come into this life for 29 years, and, that was her mission. And that was what she contracted for. That makes sense to me. So it's not like, natural cures don't work. Everything works to a degree. You just gotta, if something doesn't work, it's just part of what is. And, it's not that natural remedies don't work. It's just that, maybe something, maybe someone's doing everything right, but they're, living next to a cell tower and no one thinks about that, and so, wow. Gualethio says, I'm from Ethiopia but live in the States, and I've learned so much from you and Dr. John Bergman. Wow, that's awesome. How did you come here from Ethiopia? That's amazing. That's so great. Joe Mama says, thanks as always, another very uplifting session. See you Monday. Thanks, Joe. I appreciate that a lot. Monday's going to be fun. We'll have Zirin on the show talking about Lyme disease and empowering people. Go check out his YouTube channel, Know How Things Work. I just watched a video of his recently on the magnetic pulsar. So cool guy, cool guy. Know how things work. All right, guys. Well, I think I'm going to go. I've been fasting for a good 18 hours, and I'm getting a little hungry here. So I think I'll do that. And if you follow us on Instagram, you'll probably see more of what we do during the day. And we love you guys very, very much. Thank you for your support. Thanks also, you guys, for buying through our Amazon link. You guys don't realize, but when you purchase, go to our website, Extreme Health Radio, and scroll to the bottom, and you'll see an Amazon link. And when you purchase through that, it really helps us. And I just can't thank you enough. So thank you for that. Thank you for visiting our store. We're going to be adding some more products here pretty soon. And, that's how we keep everything free. So love you guys all. Thank you. You're an animal. You're great. Great to have you here. Have a great day in San Diego. Joe Mama, great to have you here as well. Nikki, love you guys all very, very much. Rebecca, and you guys are just great. So, all right, guys, just know that you're doing the best you can, and keep working at it. Keep doing good things for your health. Remember that you're worthy of your own health and your self-care practice. You're worth it. You're worthy. So keep doing it. Keep staying strong and positive. We love you very, very much. And let me bring up our little disclaimer here so you guys can check that out. We'll see you on Monday at 10:45 with Zirin talking about Lyme disease. Love you guys very, very much, and we'll see you soon. Bye-bye.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this blog or to start any health program without first consulting a health professional. The content found here is for informational purposes only and is in no way intended as medical advice, as a substitute for medical counseling, or as a treatment/cure for any disease or health condition, and nor should it be continued as such. Always work with a qualified healthcare professional before making any changes to your diet, prescription drug use, lifestyle, or exercise activities.
Good people.
This information is provided as is, and the reader/viewer assumes all risks from the use, non-use, or misuse